Hello everybody. I'm Dr. Shimizu from Kyushu University, Japan. It's 1 o'clock p.m. here. Welcome to the medical working group session named Sakura Science Planning Meeting. For the participants from the APAN meeting, I'd like to briefly explain what the Sakura Science Planning Meeting session is. So the Sakura Science Program is a short invitation program supported by Japan Science and Technology Agency to give the inspiring opportunities to young researchers and educators to experience cutting-edge science and technology here in Japan. And actually, Kyushu University won the grant this year to invite the doctors and the engineers from 5 countries, including Kazakhstan, Kyrgyzstan, Mongolia, Bhutan, and Fiji. But unfortunately, due to the coronavirus pandemic, we have to postpone this 1 year to the next year. We are requested to have an online meeting to make a preparation for the next year among the expected invitees. That's what this session is. And for the remote participants joining us today, hello again. And I think many of us, this is the first time to meet each other. So we don't know who they are and something like that. But, expectedly, we all get together here in Kyushu University sometime next year to meet face-to-face. So today, we would like to expect to have a presentation from each country, basically both by doctor and by engineer, to introduce your hospitals or your current conditions of the telemedical activities, or whatever you expect to do when you come to Kyushu University and something like that. So in this program, we will have presentations from each country one by one, followed by the brief introduction of the program you will get when you come next year. And then if we have some time left, we'd like to have some interactive discussion among all of us. So the allocated time for each country is about 10 minutes, including question and answers. So I hope that each country will finish the presentation within 10 minutes so that we can have some discussion later. So that's all my introduction. So, let me see. I'd like to introduce our own staff in Kyushu University because they don't have a chance to introduce themselves or any presentation. So, Kudo-san, first, can you briefly explain who you are?
Okay. Hello, everyone. This is Kuriko. I'm the engineer, chief technical officer of TEMDEC, and I'm in charge of the engineers training in TEMDEC. And we have 3 more staffs today, 2 coordinators and 1 engineer. And please make short introduction, Komatsu-san.
Hello, everybody. I'm really glad to meet you today. I'm Komatsu. I am Secretary of TEMDEC, and actually I'm in charge of Secretary of APAN Medical Working Group. Nice to see you. Thank you.
Tomatsu-kun.
Hello, everyone. This is Shunta Taimatsu. I'm chief engineer of this session. So if you have any technical issue, please feel free to let me know. So enjoy your session.
Okay, Hayata-san.
Hi, hello everyone. I'm Mio Hayata, the Secretary of TEMDEC. Thank you so much for your cooperation so far. And then I'll do presentation later, so please keep watching. Thank you.
Okay, thank you very much. So I'd like to invite the Fiji team first, and I'm afraid that they are encountering some typhoon or some bad weather. So I wonder if you're okay now in Fiji. So anyway, I'd like to invite Dr. Vikash. You are the only one from Fiji today, so could you start your presentation?
Hello, and Bula from Fiji. Bula is our traditional greeting. Thank you for inviting us to be part of this program and the opportunity to participate in this forum today. As you've mentioned, we've just had a cyclone hit us. It was a category 3, brought with it a lot of flooding. So we're still having issues with electricity and internet connectivity, but fortunately I'm able to connect from work. Our IT engineer is unfortunately unable to join us today.
Okay, but your background is virtual, right? It's not live.
It's a virtual background.
Okay. Okay, just go ahead.
All right, I'll share my screen now.
Okay, please.
I hope everybody is able to see.
Okay, we can.
Okay, so I'm part of Fiji National University College of Medicine, Nursing and Health Sciences here in Fiji. This is a relatively new university established not so long ago, in the past 10 years or so. It was a government initiative, but the colleges which are part of the university has been in existence for quite some time. There are 5 colleges within the university, and there are 2 technical training centers. I'm part of the College of Medicine, Nursing and Health Sciences. And formerly, this college was the Fiji School of Medicine, which was established in 1885, and Fiji School of Nursing, which was established in 1893. So well over 100 years. We look after regional training of doctors and allied health staff and nurses. We train individuals in Fiji, Tonga, Samoa, Solomon Islands, Vanuatu, Micronesia, Cook Islands, Niue, and Nauru. Our faculty member here at the Fiji School of and the College of Medicine is 49. So this gives an average of about 3 to 4 specialists per discipline who are tasked with the training of undergraduate and postgraduate doctors. We do not have our own university hospital, but training in Fiji is conducted at the major divisional hospitals. These are located in each of the major divisions, which is the central, northern, and the western. And the main center is in the central division, and the main training center for students is the Colonial War Memorial Hospital here in Suva. As mentioned, we do undergraduate and postgraduate training. And more often, students come into the country for training, but recently there has been some postgraduate training conducted in the regional countries with distance supervision. And more so over the past year because of the pandemic, students haven't really been able to come in. So medical needs in the country, we're a small developing island nation. with limited resources. So as most of you would understand, there would be lots of needs, but I will be mentioning just a few, and I think the ones which are probably more relevant at this time. We have a rising NCD burden, and we need innovative solutions for that. Our highest mortalities are from the NCDs, and that mostly includes cardiovascular diseases. We need for advanced medical training and development of subspecialty and also skills enhancement. At the university here, we are trying to develop more of flexible learning so we can entertain some distant learning for students as well. So I think in this regard, this working group would be quite useful to us. We're also looking at telemedicine. We have quite an isolated population, especially in maritime zones, which have very basic medical setups. So we want to be able to support them better. So we're looking at ideas as to how telemedicine can be developed. We need mentorship for practitioners and also specialists. We don't have subspecialty areas, and we kind of need support in these sort of areas to guide us. Our patient information system, which is the medical information system, is underdeveloped, and usually we suffer from issues of loss of data and things regarding patients. We still rely on hard copies of patient data, which easily go missing. So I think this is an area that the country needs to put effort into developing. Now, I have put this climate change and natural disaster resilience before the cyclone hit us, so ever more it becomes more important. It is a major challenge for us, and we need to look at innovative solutions to these. And obviously, any health system needs proper planning and management, and there's need for human resource and infrastructure development. Okay, so expectations while in Japan, obviously networking and development of links with subspecialty areas. This can enhance our training locally, and it may help us, develop clinical exchange programs. Ideas on developing telemedicine at the basic level. Again, distant and flexible medical education is something that we are embarking on. So maybe the forum can help us and the training can help us guide us in these. I'm an internal medicine physician by training, and my area of interest personally is gastroenterology, and I've done some endoscopy training. So was hoping that I could get a interventional endoscopy attachment while there as well to help further my skills, and also link up with specialists who can provide guidance when there's a need. Well, that was my short presentation. I think that was probably well below 10 minutes.
Okay, thank you very much. So we will skip the presentation from engineer. You are engineer, right?
Yeah, you would have to, because I wouldn't be able to fill in his.
Okay. Okay, so we may ask him or her to make it when he comes here. Okay, sure. And actually we got the draft of the presentation, so we can review it ourselves. So thank you very much. So let us make some discussion later. If anyone have any questions or comments now, I may pick up just one, if any. Okay, if not, so let's go to the next country, which is Bhutan. So please make it within 10 minutes if possible. So I'd like to ask Dr. Sonam first to make your presentation. So could you stop sharing from Fiji?
Yep.
Okay. Okay, so Dr. Sonam, please start your presentation. So maybe 5 minutes for doctors and another 5 minutes for engineers. So please.
Good morning, everyone.
Morning.
So can you all see my?
Yes, we can.
Okay. Good morning, everyone. So it's nice to see everyone in the forum. So we had been planning for this meeting for so long. Unfortunately, we are unable to meet face to face. So today I will be presenting the the medical the infrastructures, the human resources that we have the problem we are facing in Bhutan. So the background of the picture you see on the slide is the hospital where I work is a regional referral hospital in southern Bhutan. The population of Bhutan is around 7 lakhs, 7 lakh 50,000. So the life expectancy has gradually increased up to 70 years. And as you know, our Bhutan changed to constitutional monarchy from 2008, and the state religions of Bhutan is Buddhism and Hinduism. And our literacy rate has basically now came up to 60%. The healthcare system in Bhutan is mainly funded by our government, and we don't have any private hospital in Bhutan. There are some private diagnostic facilities available in the northern and western part of Bhutan. So this is the referral systems that we have in Bhutan. We have a primary healthcare unit, which is called the basic health unit earlier, and the systems are the patients are referred from basic health unit to district hospitals, and there are each district hospital in all of the districts, and there are 20 districts in Bhutan. And from the district hospitals, the patients are referred to the regional referral hospital. So there are 3 regional referral hospitals in Bhutan, and there are 1 tertiary care unit that's in the Thimphu, the National Referral Hospital. So that's the referral systems in Bhutan. And the patient, whoever required a referral treatment, are being the cost of the transportations and others are being managed by the government, borne by the government. So the treatment in Bhutan for the patients are relatively free, though there are some out of pocket expenditures that are also included when the patients are being referred or being treated in the higher centers. So in the hospital, it's located in Galifu, the southern southern Bhutan, and as per our annual health bulletin, there are the specialist in Bhutan is around 114, and there are some general duty medical officers or those who have passed the bachelor's in medicine surgeries around 204, and other dental surgeons. So the strength of staff in my hospital in CRRH is we are consists of general surgeons too, and I am the lone Bhutanese surgeon here, and we have 1 Bangladesh surgeons who is on contract from the Bangladesh, and we have 2 pediatricians, 1 medical specialist. So as you can see, these are the strengths of our doctors, the specialists in my hospital. So basically, as you can see in this graph, so I got this graph from the annual health bulletin of Bhutan, and the problem with the alcohol, one of the most top 10 killers in Bhutan is the alcohol liver disease, and the incidence of cancer has been increasing in Bhutan year by year. These are just a few the medical needs of my country, though there are so many diseases that are affecting, but we have a program in the Ministry of Health that are dealing with like NCDs, cervical cancers. But from my the surgeon's perspective, what I felt was this is the medical needs of the country at the moment. So there are so many human resources problems, like we have only few surgeons who have done the subspecialty. So there are need for so many subspecialty in Bhutan, especially for example, for Bhutan, we have just one onco surgeon who deals with the cancers uh, for the population of 750,000. And the important drawback that the Bhutan is having is for early detection of the cancers. So we need the program, though we are trying, but though we are trying, but still we are lacking in the the program or the investigations that we are not able to detect the cancers early, so that a patient can be treated as early as possible. So they come very late and in the advanced stage of the disease, and then it becomes and there is actually inequitable distribution of health infrastructures in the country as well. And most of the patients, they have to travel from eastern regions to the western regions because the tertiary care center is located there. But hopefully our current government is trying their best, I mean, to relocate those structures, but the problem is with in the lack of the both infrastructures and the human resources. So hopefully in next 10 to 15 years, we might have the equitable distribution of health infrastructure and human resource in Bhutan. The expectations that I came up is how through this telemedicine, how to develop our human resources through telemedicine or through provision of training or whatever. And as I said earlier, how to detect the early cancers so that we can prevent the death in the patients. And my expectations is how to maximize our efficiency in delivering the healthcare services despite having the limited resources in human resource. And that's all. Thank you.
Okay, thank you very much, Dr. Sonam. So let me go to the engineering presentation. So Mr. Sherin or Mr. Karma, which of you are going to present? So please understand that we may have to a little bit in a hurry. So please keep it in mind and start your presentation.
Hello, good morning.
Hello, please start.
Good morning. My name is Sring Samdrup, and I'm engineer of Desagalpa Medical University. So before I start with my presentation, I would like to make a statement saying that my presentation consists of two candidates. One is myself, and another one is an engineer from Ukraine, DIT. Parma Jamyang will, after my presentation, he will continue with his presentation from Ukraine.
Okay.
So, from our university, I would like to present brief about the resources. So, in our university, we have two ICT officers. One, we have recently recruited. She's a passed out from the one of the renowned engineering college in our in Bhutan. And then regarding the internet speed, we are having 20 Mbps bandwidth. With the support of Ukraine, we are having 100 Mbps bandwidth speed. And then regarding the network equipment we are using, currently we are using Cisco L3 as a router, and then Cisco X switch Catalyst. And virtual conferencing equipment, we are using Logitech Meetup all-in-one expansion mic. And then another one is we are using Grandstream V320 version. So activities, so far we have conducted like a virtual professional health conference for international health professionals. And then we have conducted even international medical conferences, which actually we used to conduct face-to-face, but due to COVID-19 situation, we couldn't conduct face-to-face conference this time. So we have conducted sixth international conference on virtual. And with collaboration with Kyushu University and Doctrine, we have conducted Bhutan-Japan Joint Medical Webinar 2020. And then it was successful, and then it was one of the main events that we have conducted very without any disturbance in the network, and then it went very smoothly. And then another one, we have conducted a health policy dialogue by the university, which is organized by our faculty of postgraduate medicine, and then the engineers involved are from the university and then faculties as well. And then from here, Mr. Karma Jamyang, engineer from Ukraine, will continue.
Okay, please.
Thank you very much. Good morning to everyone. I'll make my presentation very, very short because we have a very limited time. We have 5 staff working for the Drukren project under Department of IT and Telecom. Our backbone, Druk Research and Education Network, is a dedicated research and education network for research and education community in Bhutan. We have multiple 10 gigabit per second network built on DWDM infrastructure. We have also provide commodity internet that is basically international commercial transit. Right now we are subscribed to 2G, but our capacity is 10G. We also interconnect with all the network operators at Bhutan Internet Exchange at 10 gigabit per second. We provide connection to the hospitals, to schools, to all the research and education institutions, university, and we provide a very high speed. At the max, we provide 1 gigabit per second. We have around 25 research and education institutes connected currently to Druk Research and Education Network. We use in our backbone Juniper MX series routers and also Juniper EX series switches. With regard to the virtual conference, video conference facility, we have issued a supply order to procure Logitech Rally. So we do not have right now any video conference system, but we used mostly the Zoom to carry out video conference. And currently, with regard to the activities that we are carrying out, we have commissioned the Druk Research and Education Network interconnecting only 11 districts out of 20. So what we are right now doing is to expand further the coverage of Druk Research and Education Network to cover all the research and education institutions in the country, including hospitals and schools. So ultimately, we will be connecting around 600 institutes in total. within the span of next 1 to 2 years. We have met with, because of this COVID-19 pandemic, we could not complete the project, but we are hopeful that we will be able to increase our coverage to cover all the 20 districts and connect 600 research and education institutes, hospitals, and schools by end of 2021. So we are also jumping and into providing data center services. So where we provide computational resources, storage resources to our hospitals and schools. So with regard to the telemedicine activities, currently we have carried out about 3 activities. Number one, Asia Connect launch event was carried out and where we launched the Duke Research and Education Network's international research and education connectivity with Trans-Eurasia Information Network on 20th August 2019, where we had Dr. Shimizu present on the telemedicine, especially on the gastric cancer endoscopy. We have had a live demonstration of endoscopy, and then it was followed by another Bhutan telemedicine domestic workshop on 15th October 2019, which was co-organized by Dukren with Kyushu Hospital University, TEMDEC, and Ministry of Health from Bhutan. Then, as already mentioned by my colleague Sering Samrup, we have had a very successful Bhutan-Japan joint medical webinar 2 months ago on 10th December 2020. With regard to expectations, we are looking forward to gain knowledge and also skills in the telemedicine field. We are looking forward to understand and familiarize with the different environment requirements. We of course look forward for social networking and collaboration with all the other participating country, and we would very much looking forward to experience the cutting edge science and technology deployed by Kyushu University when it comes to telemedicine. So that is an end of my presentation.
Okay, thank you very much, Mr. Sharon and Mr. Kama. Okay, thank you. So due to the time limitation, I think I don't think we can have any questions. So let's discuss at the very end of all the presentations. So let me invite the Mongolian team this time. So I have Dr. Artantia and Ms. Munkatsu. Could you start your presentations? So could you turn on your microphone? Okay, please start.
Hello. Hello.
Hi. Hello, we can hear you and see the presentation.
Good morning, Shimizu
Okay.
Shizuku Professor. I am Ashpuntoya from Mongolia. Our Japan-Mongolian Teaching Hospital of Mongol National University of Medical Sciences medical needs of the country, development of human resource infrastructures, early detection of preventable deaths due to cancer, improving the quality of care provided by endoscopy in cases of cancer, organize continuous human resource training. Expectation while in Japan. I really want to visit Japan and see the development of Japanese medical structure, expand my medical knowledge as well, especially its gastroenterology and endoscopy field. And I'm willing to get acquainted with the activities, high technology, research work of the University Hospital of Japan, get ideas from the activities of the Department of Gastroenterology and Endoscopy and introduce them to the hospital. Thank you for your attention.
Okay, thank you very much. So maybe Ms. Munkto will continue, follow the presentation.
Hello, everyone.
Okay, just go ahead.
My name is Mingto. I'm from Mongolia. I work at Information Technology Department of Mongolian Japan Hospital. Mongolia Japan Hospital is located in capital city of Mongolia, which named Ulaanbaatar. Here I am showing Mongolian map and hospital photo. This hospital was created by the people of Japan. In my view, this hospital is big present for Mongolians from Japan people. This is my presentation outline. I want to explain here about Department of Information Technology of Mongolia Japan Hospital. I work at this department as data analyst, and the department is established in 2019. Before I say that hospital is big present from Japan people, I'm glad to work here. About our department responsible, first, we work to develop an information system for hospital. Second, we should set up, develop, and maintain computer and networks. This is our department structure and organizational diagram. I work at data analyst and belong to a system development unit. Also, I manage and organize the system development unit like a senior engineer. Here I introducing responsibilities for our job description of our information technology department staffs. Hospital network speed is 40 megabytes. Hospital network zones are management, office, keys, hospital information systems, PACS, reception, and telephone. Hospital has many type of machine, gastrology set, angiography, mammography, MRI, and CT. As I mentioned earlier, the IT department is responsible to develop, maintain, and set up and electromedical system. Can you hear me?
Oh, yes, yes. A little bit interrupted, but now okay. Just continue.
Okay. And laboratory information system, PACS, and insurance system. We plan to develop inpatient system and intermediate system for connecting PACS and HIS. It's named Radiology Information System in 2021 and introduced the telemedicine in the hospital in 2022. Here is your show. She was the first doctor who is studied in TMDEC. We all thank for her about connect us to TMDEC. Now we don't have professional telemedicine room, but we and our doctor we try to connect telemedicine with TMDEC. As part of the JICA project, the hospital will receive video conferencing equipment such as a TV, laptop, microphone, and video camera. I expect to learn the following aspects from the training in Japan. First, to learn about structure and development of hospital information technology of Japan and have valuable real experience on that. Second, study about interaction and cooperation of hospital information system. Then acquaint with telemedicine technology and systems as well as network structure. Last one, study possibilities for the development of telemedicine in Mongolia. Thank you for your attention.
Okay, thank you very much for your presentations from Mongolia. Okay, so next, let us have a presentation from Kyrgyzstan. So Dr. Maksat and Mr. Alexei, could you start your presentations?
Okay. Thank you very much. My name is Maksat. I'm from Kyrgyzstan. I am endoscopist and gastroenterologist in the National Center of Cardiology and Therapy. Thank you for giving me an opportunity to speak. Introduction of your hospital. National Center of Cardiology and Therapy, NCCT, named after Minister Mirahimov, at the Minister of Health of the Kyrgyz Republic, is the highest scientific, medical, and educational and industrial medical institution of the Kyrgyz Republic in the field of cardiology, internal and mountain medicine. Polyclinic of consultants and diagnostics. Number of employees is 28. Annually, 5,000 patients are observed, and more than 10,000 patients are hospitalized. Treatment and diagnostics division, where functional and ultrasonic studies are conducted, as well as computer and X-ray division, where diagnostics take place, research and diagnostic laboratories, where clinic biochemical and immunology analysis are conducted. Stationary treatment at the Turashu mountain pass, 3,200 meters above sea level. NCCIM overall have 601 employees, from which 155 are doctors and science employees. Stationary treatment for 333 patients. Consultative and diagnostics division, we have cardiologist, rheumatologist, gastroenterologist, pulmonologist, nephrologist, endocrinologist, allergist, neurologist. My workplace, on the next slide, I will show you my workplace as a doctor gastroendoscopist. The name of the device of videos endoscope Pentax AG90K and video processor Pentax APC 1000. Annually, 7,000 patients undergo this the Pago gastroduodenoscope procedure, including 500 ATB biopsy. Why do we have so low biopsy cases? That is because we have patients who take a double or triple dose of anticoagulants and anti-aggregate therapy. This is my workplace. In the National Center Cardiology and Internal Medicine, the number of causes of stomach cancer in the late stages is 15, 16 cases per year. Unfortunately, patients are admitted in last stages. The method of treatment is surgical, followed by chemotherapy. Why do we have such low number of cases of early detection of stomach cancer? Lack of active detection of screening programs, insufficient provision of endoscopic equipment, insufficient qualification of endoscopists, lack of staging at the diagnostic stage. My medical needs in my country, the need to equip with modern endoscopic equipment, training endoscopists about modern methods and protocols for conducting endoscopic examinations, the need to introduce modern methods of endoscopic examination. My experience visiting in Japan, increasing the level of my knowledge. I hope to learn about new methods, new skills in conducting endoscopic studies and manipulations, introducing them in daily practice of Kyrgyz endoscopic doctors. Thank you very much.
Okay, thank you very much, Dr. Maksat. So next, Mr. Alexei, can you start your presentation?
Hello, everyone. Let me introduce brief IT in our center. Engineering staff, Chief IT Manager, it's me. We have assistant of IT Manager, IT team who work with MIS, Medical Information System, IT team with LIS, Laboratory Information System, who work our network and equipment. Internet speed in our center 15 megabit per second, local network 100 megabits second. MIS, we have cloud outsourcing. LIS, we have cloud outsourcing. Computer more than 300 in our center. This slide you can see network topology. Digital and telemedicine equipment, our institution. We have computed tomography, ultrasound device, endoscopic equipment, laboratory equipment, angiograph equipment. MRI equipment is planned to be acquired this year. Polycom equipment. Intended activities or programs. We want upgrade and expand local network to 1 gigabit. Network speed increase up to 100 megabit second. Purchase and installation of PACS system. Now we not have PACS. Improvement of the telemedicine cabinet. MIS upgrade. Purchase of equipment for broadcasting hybrid conference online with offline. Now we use or online or offline. Hybrid we cannot do. Combining PACS with MIS system, choose alternative program for telemedicine, Zoom, GoToWebinar, and etc. Now we can use Polycom. Expectation while being in Japan. I expect to learn the following aspect from the training in Japan. Learn hybrid teleconference technology. View a new teleconferencing equipment in action. Study the experience of Japanese colleagues in buildings, information technology in hospitals. Learn and explore network infrastructure. Thank you for your attention.
Okay, thank you very much, Mr. Alexei. Okay, thank you, and nice meeting you again. Okay, so let's move to the Kazakhstan, the last country we will invite. So I'd like to ask Dr. Aset and Ms. Ainu for the presentations. So could you start?
Good day.
Okay. I can also see the Dr. Kanat with you.
Yes.
Nice meeting you again. Okay, just start.
Konnichiwa. Good day. I have a presence National Research Oncology Center, Kazakhstan, Nur-Sultan city. I am an endoscopy doctor from Department of Expert Endoscopy of National Research Oncology Center, Nur-Sultan, Kazakhstan. Education, Semey State Medical University, postgraduate education, Kazakhstan, Russia, South Korea. Experience about 8 years. My fields gastroenterology, oncology, interventional pulmonology. The center conduct clinic education and scientific activities. The captive of this center in 232 beds. The center is the leading in Kazakhstan in the field of the introduction of oncology, transplantology, and resuscitation. We have the 12 departments: reception, cancer, center of radiation and functional diagnostics, center of expert endoscopy with interventional radiology, center of pathomorphology and laboratory diagnostics. Some information about screening. Kazakhstan has had a national colorectal cancer screening program since the first step in Hemocult test is the Hemocult test with positive as Kran's colonoscopy is performed. The total number of cancer is 931. The first stage 6%. The second stage 42%. And the third about 20. The fourth about 30%. Medical needs in Kazakhstan. Medical equipment of expert level, not a wide range of medical accessories, single as use, and not have a good education, cancer wide simulation moulage. Execution of my traveling to Japan. Improve my knowledge, drop of the my skills of the endoscopy treatment, find out this department of gastroenterology works, to learn more about Japanese style of using endoscopy diagnostic, to know Japanese culture and visit famous castle like Kumamoto.
Good day for everyone. My name is Ainura Gitaeva, and I'm supporting the medical information system in this center. We have some problems in this question, such as resource. We usually use wide telecom system for telemedicine around of Kazakhstan. Only 2 engineers who can make connect by telecom system. And our internet from Kazakh telecom provider with speed around 100 megabit per second. Not any activity with other countries during this year. Expectation of my traveling to Japan, improve my knowledge, drop up of my skills to do telemedicine conference, find out how the center of telemedicine works, to learn more about using equipment to make telemedicine conference or webinar, and to know Japanese culture and to visit famous castles like Kumamoto. Thank you very much.
Okay, thank you very much. Very interesting words heard from Kazakhstan is a Kumamoto Castle. But you know, the Kumamoto Castle was actually broken down due to the earthquake several years ago. But now they are almost rebuilt. And I hope that by the time you come here, that it will be newly built, renovated, and you can visit there so that you can meet some ninja performance and something like that. And I suppose that the Kana should have been very much impressed with the Kumamoto Castle.
What about Kuratsu Castle near?
Kuratsu, yes, it's still good in shape. So you can go there anytime.
Yes.
And there are many, many castles if you take a train longer, you know, as you may know. So yeah, they can visit some of them for sure. Okay. So regarding this kind of Japanese culture, our coordinator, Miss Miho, will introduce you, your program when you come sometime later. Okay, so Hayato-san, could you start?
So I'm Miho again. Thank you so much for wonderful presentation today. So do we have time limitation? So let's get the ball rolling.
Okay, just could you stop? Could you show the first one? First slide. So this flower should be Sakura. Oh, no.
Yes.
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 Okay.
That's why I choose this one.
Yeah.
Yes.
Okay. Good. Okay.
Okay. This is the Sakura. Yeah. So today I'm gonna talk about the schedule for training at Kyushu University Hospital Japan in Fukuoka. As I mentioned before on the email, the actual accurate date have not decided yet. So please note that this is a tentative one. So please be relaxed. So mostly we will training at Kyushu University Hospital Japan in Fukuoka. So first week, all of your tasks are orientation and on-the-job training. And the second week, advice training at Kyushu University Hospital, Fukuoka University Chikushi Hospital, and the Fukuoka Red Cross Hospital. The last week, all of your tasks are preparation for telemedicine program and do telemedicine program. In the meantime, you have open space for study trip. So you have in Oita, Osaka, and Kyoto, and you have opportunity to visit RoboCare Center and Osaka International Cancer Institute and historical places. So let's move on to the next slide. So this picture last year training for endoscopists. They are training actually using PIC. This for surgeon. They are also training actually using laparoscopic. This for engineer. So they are learning how to use conference video system, such as how to control sound from remote site and so on. So this page will definitely most interested in things all of you. So we are here in Fukuoka, and then we will visit 4 prefectures. There are others, Oita and Kyoto and Osaka. Sorry, we don't have the opportunity to visit Kumamoto. So the machine in RoboCare Center is world first wearable cyborg HAL. It's for functional improvement of clinical nerve and muscle. So I think some of you can actually try it. And obviously, Kyoto is massive city in Fukuoka. So I really love this place and personally recommend this place. So you can get a true picture of traditional Japan if you will visit Shindo Shrine or Buddhist temple like Kinkakuji. So it's time to wrap up my presentation. Before we close, please let me just summarize today's main point. The first, the dates we'll announce once we have decided. The second, a questionnaire will be sent you after this conference, so much appreciated if you cooperate. And if you have any question or concern, please let me know later on the email. I'll be happy to help you. So hope we could meet in person in the near future. Thank you.
Okay, thank you very much, Hatsan. But could you keep showing the second slide about the schedule? Let me repeat some of the schedules, okay? So as she already explained, we are supposed to have 3 weeks. And most of the time, you are supposed to stay in our hospital to have a training each for surgeon, endoscopist, and engineers. Each team have a different programs. And yes, and then in the weekends, we will have probably 2 weekends, and one weekend we will take you to Oita City, 2 hours train ride, as she explained, show some pictures, and we will take you to some scientific places as well as some sightseeing places. And the second weekend, we are going to take you to the Osaka area, which is about 2 hours bullet train ride. And sightseeing time in Osaka and Kyoto. But as you see here in Monday, we will stay there 2 nights, 3 days, different from the first weekend. First weekend, we will have only 1 night stay in Oita and just during the weekends. But the second weekend, we will stay 1 more day so that we can visit the Osaka International Cancer Institute, which is a very famous hospital specialized in cancer diagnosis and treatment. And they are very active for the international collaborations, including telemedicine. So that's why we chose this center, and you will visit this hospital on Monday, on the second weekends. And during the first weekdays, hope that we will take you to the study trip shown here to the museum, scientific museum in our local city. And then the second week, during the weekends, we will pick up one day again for the study trip, taking you to another major hospital nearby. One is the Chikushi Hospital, Fukuoka University, which is for the endoscopy, where the Dr. Yao, very famous gastric endoscopist, working. And then the Fukuoka Red Cross Hospital, where the very famous surgeon working. So that's why we will take you guys there. These are for only for the doctors. And the third week, we are going to connect to all your hospitals, your own hospitals, to make a report presentation to each, each hospital, just as you did today. Make a presentation, sharing with your own staff, with 5 countries, all your countries. Okay, so those are the rough schedule. So first, I'd like to invite some questions from all of you about the schedule or stay in Japan, any concern, any expectation, anything you have in mind. But I just wonder, you may not have any free time. All the schedules seems to be very much packed. So I'm not sure if you can find the time to visit Kumamoto. Just looking at this. So we will discuss and we may revise, or let's see. So we don't actually have any answer, clear answer now about that. But anyway, we will try to do it for you, because Kumamoto seems to be very, very attractive especially to the Kazakhstan team. Okay, so anyway, you are free to ask any question. Just unmute your microphone and speak up if you have any question about Japan. Yes.
Hello.
Yes, Dr. Sonam.
This might just personal, just personal questions. Actually, we have 3 weeks, right?
Yes.
I mean, in 3 weeks, we may not be able to, learn the advanced endoscopic training. So I am thinking if there will be a chance to do a further training for the extended time, like 1 or 2 months. I think if you do for some such kind of training, then after coming back to my own country, then I will be able to provide the services what I have learned in Japan or something like that.
I see. So yeah, actually, I wish I could. We wish we could, but each grant has its own limitation. So with this particular grant program, they do not allow for the participants to stay over 21 days, even if you have another grant for you to stay here longer. So that's the limitation. So hopefully we can have another chance to invite you, separately sometime later. But during this, we cannot do that. So you have to concentrate and try to make the best benefit, during your stay. So we can show you the very advanced procedures. So you may be able to see as many as procedures while you are here. But I remember that you are a surgeon. right?
Yes, I'm the surgeon, but I do only the basic endoscopy like upper GI and lower GI, but not on the intervention endoscopy.
Okay, so we have actually surgeons who, of course, who are interested in surgery, but also interested in endoscopy. So our basic schedule for the surgeon is that we have operation only on Monday, Wednesday, Friday. So we do not have an operation in our own department of surgery on Tuesday and Thursday. So in those days, in between, you can go to the endoscopic room with other endoscopists to see the endoscopy, and also you may be able to join the hands-on training with a pig egg.
Yeah,
I mean the
yes.
pig stomach or something like that.
I mean to
So
say the hands-on training, right? Just
sure.
just by observation and then having a practical is totally different. Yeah.
Of course.
Yeah. Okay. Okay. Thank
We
you.
will think about it. Okay. Any idea? Any other questions, suggestions, comments? Just unmute and speak up if you have any. No more question? Okay, if so, or you can ask any questions anytime later. But then shall we ask some of them some questions? Any engineering staff, any questions to the invitees?
Yeah, can I ask
Sure,
questions?
please.
Thank you very much for your wonderful presentation. And as engineers, I am wondering how much the medical doctors is familiar for the using teleconferencing system by themselves, like Zoom. Actually, you are using. So in Japan, since COVID-19 pandemic, many meeting is done using this kind of system, and people is very familiar to use. But how about your countries? First, how about in Fiji? It's very common. Dr. Bikash?
Yeah, so we do have video conference and Zoom. So most doctors can use Zoom by themselves. So they can set it up and get connected. The video conferencing equipment, however, we do need our IT engineers to come and help set up that for us.
Okay, so participation is no problem.
Sorry?
Participation of Zoom is no problem.
No problem at all. No.
Thank you. And Bhutan? How about Bhutan? It's same?
Yes. Only problem. I mean, we can connect through laptop, phones. The only problem that we have is with the internet connections, especially in my hospital. But as for like in northern part of Bhutan, like in Thimphu, they have stable internet connection. But hopefully, we will be able to get a good stable internet connection in few months' time. So after that, I think there shouldn't be a problem.
Okay, thank you. And how about
if I may
yeah,
add
please.
on what Dr. Sonam just submitted his views. The Druk Research and Education Network was primarily built to address the connectivity issues faced by the hospitals, and not just hospitals, schools, and also other research and education institutes. And today we are providing Zoom licenses to our members, to our 28 currently connected research and education institutes, and that also includes few hospitals. So the main primary objective of Druk Research and Education Network is also to have some kind of on-premise Zoom service deployed in our network, so that the members can then benefit from the high-speed network that we provide. So currently, right now, we do not have on-premise Zoom controller deployed in our network, but in the next 2-3 months, we are going to deploy this Zoom in our network, the controller, so that then they will have faster access to the Zoom controller, and then the traffic will not be required to leave outside Bhutan. So that is the one of the projects that we are currently working on. And like you already mentioned, it is same in Bhutan also because of the COVID-19 pandemic. Participation in the virtual conference meetings, seminars has increased drastically, and then the users have been left with no option but to learn how to use all these video conference softwares, video conference platform like Zoom. And Druk Research and Education Network, Department of IT and Telecom, we have recently carried out training for the engineers of all the research and education institutes, including Kesagelpo University Medical Science ICT officers, where we train them how to use Zoom and how they can help and further train the users, especially the doctors and the nurses, so that they can effectively participate in any meetings, seminars using Zoom. So we will continue to train all the engineers, and then hopefully that will benefit the hospitals. Thank you very much.
Thank you, Karuma-san, for your nice explanation. Yeah, I am wondering that what kind of training is good for you, because you already expanding your network and providing the training using providing the system, Zoom system. So please discuss, keep discuss. Thank you. And how about Mongolia? Dr. Al-Santua or Munksu, some? It's using the Zoom system or using a video conferencing system is very easy for your doctors in common. Or do you have any idea for training, engineering training in Japan? We can't hear you.
Hello?
Hi.
Can you hear me? Yeah.
Yeah.
Can you ask again, please?
Yeah. What kind of training is expected in Japan? Engineering training?
Mm. I want to learn Japanese hospital information systems, such as different systems have to connect it and have to connect and integration data and network structure.
Okay, so in network infrastructure for the hospital.
Yes.
Okay, so probably the our training aim is a little bit different, because we are focused on the remote education using audio visual. But so please discuss about the aim later.
Okay.
Thank you.
Thank you.
And so I am wondering if the Kazakhstan doctor is very familiar to use this kind of video conferencing system. Dr. Kanat or Dr. Asset, do you have any idea?
You're asking about our Polycom system?
No. And yeah, including Polycom system. So your doctors daily use this kind of system by yourself, or you need engineering help to use?
We use Polycom system very activity because our center is a leading center in country about oncology, hematology, and endoscopy. And we have probably twice connection with region clinics per 1 week.
Okay.
For example, yeah.
Okay.
For very hard cases, regional doctors can to ask our doctor about hard cases. Yeah.
Okay, so it's the conference is connecting one by one, or the conference room?
Conference room. We have conference room for it,
Okay.
and our engineer helps for doctors to connect this system. Yes, we prepare how to use it, a protocol of this conference, and then patients and doctors can use this material in their
Okay, so showing patient materials and discuss.
Yeah.
Thank you. Okay, so thank you very much. So that's all my question. Thank you.
Maybe the last question to Kyrgyzstan. You didn't ask any question to Kyrgyzstan.
Yeah. I thought, can I ask a question to Kyrgyzstan? It's very common to use all doctors use this kind of video conferencing system by themselves.
We cannot hear you. Mr. We cannot hear you. Maybe mic is off. The sign shows that you are muted, but we cannot hear you at all. I don't know why. Mic is not working.
Now?
Oh, yes. Now, okay. Now, okay. Yeah.
In our center, doctor use Polycom system with engineer. Without engineer, we cannot use Polycom. But now, with pandemic, a lot of doctors use Zoom system. Face-to-face, face-to-room, use very just every day use Zoom system. And if we want face-to-face, use WhatsApp video system.
WhatsApp video conference. WhatsApp for
Yes.
video conference.
Mm-hmm.
Okay, so every day use Zoom and also WhatsApp.
Yes.
Thank you. Thank you. Dr. Shimizu, we cannot hear.
Oh, I'm sorry. Hayata-san, could you stop sharing the slide? Okay. Thank you very much. So we have a few more minutes, but any questions probably from doctors? Any doctors? Because we discussed a lot about technology things. Any questions? Okay, so the question to you is that we only invite one surgeon from Bhutan, but other 4 doctors are endoscopists. Am I right? Yeah, maybe so. Okay, Sonam, do you have anything to say?
No, thank you.
Yeah, your mic is unmuted, so I just thought that you may have some. Okay, so anyway, yes, then the time is running up. So I do hope, I sincerely hope, I really hope from bottom of my heart that we can invite you to Kyushu University after coronavirus is subsided, clear away. And sometime later this year, we will get together in Kyushu University, Fukuoka, to meet face to face and meet each other and hopefully share the dinner, which is prohibited at this moment, and make excursion, of course, having lots of training, both in endoscopy, surgery, and technology. Okay, so as a matter of fact, we have Dr. Moriyama just showing a picture. He's back. So just a good timing. So he's now he will introduce himself, and then maybe he will make some comment about the endoscopy or program, whole in general or whatever. So he will make closing remarks, please. Maybe mic is muted.
Okay, sorry. Sorry for my late arrival, but then I have heard almost all the presentation during my driving to this hospital. Okay, I'm Dr. Tomohiko Murayama, and I'm Vice Director of International Medical Department, Kyushu University Hospital. Actually, unfortunately, we cannot invite all of you to our hospital now, but we, like Dr. Shimizu, from bottom of my heart, I really hope to invite all of you to our hospital and hope you to have a very fruitful training. And also we really hope to expand and work with all of you to expand our telemedicine activity for the global public health. So hope to see you again in Kyushu University Hospital later this year, and keep in touch. Thank you for joining us today.
Okay, thank you. I just forgot to ask Hayata-san if you have any housekeeping question or housekeeping issues. Nothing to say here.
Nothing particular, but I just few tips for you. I was near the nearby Osaka and Kyoto, and I used to work for Oita, and then I grown up Fukuoka. So I can help you a lot for study trip if you want to. That's it. Thank you for joining today.
Okay, thank you very much. So please do keep in touch. And as the time approach, we will give you the more detailed information. So by that time, goodbye and stay safe. Bye-bye. Have a good day. Bye.
Bye-bye.
Thank you.
Thank you.
Bye. See you again.